Why antibiotics should not be taken without doctor advice? Have you ever taken antibiotics on your own when you had a fever, cold, or throat pain? Many people stop antibiotics once they feel better or take leftover tablets without consulting a doctor. This may look harmless, but it is actually a very dangerous. In this video, we will clearly understand why antibiotics really are, why they should not be taken without doctor advice, what happens when antibiotics are misused, and how this habit can affect not just one person but the entire society. This is an important video for everyone. What are antibiotics first? Antibiotics are the medicines used to kill or stop the growth of bacteria. They are powerful drugs designed to treat the bacterial infections. So, the antibiotics do not reduce pain directly, do not cure fever on their own, do not work against viruses. They work only when used correctly, at the right dose, and for the right duration. Okay? So, antibiotics are not for all illnesses. A very common mistake is taking antibiotics for common cold, flu, viral fevers, cough, COVID like symptoms. These illnesses are mostly caused by viruses, not bacteria. Antibiotics do not kill viruses. Taking antibiotics in such cases gives no benefit, unnecessary side effects, and long term harm. Self medication, a common but a dangerous habit. So, many people take antibiotics based on the past prescriptions suggested by friends or family from leftover medicines without tests or diagnosis. So, this is called self medication, and it is one of the biggest cause of antibiotic misuse. Each infection is different, each person's body is different. Only a doctor can decide whether antibiotics are needed or not. Wrong antibiotic is equal to no cure. Not all antibiotics work for all bacteria. If the wrong bacteria is taken, infection may not cure. Symptoms may temporarily reduce. Infection may return stronger. So this makes treatment more difficult later. So doctor choose antibiotics based on the type of infection, severity, patient age, medical history. So self-selection often fails here. Wrong doses is dangerous. Taking antibiotics at the wrong dose can be harmful. Low dose does not kill bacteria, allows bacteria to survive. High dose causes toxicity, increases side effects. So, only a doctor can calculate the correct dose for safe and effective treatment. Stopping antibiotics early, a very common mistake. So, many people stop antibiotics when fever goes down, pain reduces, they start feeling better. But this is dangerous. So, stopping antibiotics early leaves some bacteria alive. These bacteria become stronger, so infection can return. So, doctor prescribe a full course for a reason. So, what is antibiotic resistance? Antibiotic resistance occurs when bacteria learn to survive antibiotics, stop responding to treatment. This happens due to unnecessary antibiotic uses, wrong antibiotic selection, incomplete courses. Resistant bacteria are called superbugs. So these infections are difficult to treat requires strong medicines, increased hospital stays, can become life threatening. Why antibiotic resistance is a global problem? Antibiotic resistance do not affect only one person. It affects families, communities, hospitals, and entire countries. Simple infection may become deadly in the future if antibiotics stop working. This is why doctors strictly control the antibiotic uses. Side effects of unnecessary antibiotics. Antibiotics can cause nausea, vomitings, diarrhea, allergic reactions, skin rashes. They also destroy good bacteria in our gut, which are important for digestion and immunity. So, using antibiotics without need exposes the body to unnecessary risks here. Special risk in children and elderly patients. So, children and elderly people are more sensitive. So, wrong antibiotic uses can lead to several side effects, poor immunity, and long-term health issues. Never give antibiotics to children without doctor advice. When are antibiotics actually needed? Antibiotics are needed only when infection is bacteria, doctor confirms diagnosis, tests indicate bacteria causes. So, doctor may use clinical symptoms, blood tests, culture tests. So, antibiotics are life saving when used properly only. So, safe use of antibiotics. Always remember, take antibiotics only if prescribed. Follow dose and timing strictly. Complete the full course. Do not share antibiotics. Do not reuse old prescriptions. Responsible use protects everyone here. So the conclusion is antibiotics are powerful medicines, but they are not ordinary drugs. Taking antibiotics without doctor advice can harm your health, can lead to resistance, can affect the future generations. So antibiotics should be used wisely, carefully, and only when needed. Spread awareness, not resistance. Use antibiotics responsibly and protect their power for the future. Thank you.